Measurement-based care ultimately is the only way that we're going to be able to get greater parity when we seek um, better relationships with payers, where we're able to negotiate kind of on par with other parts of the healthcare system. Um, the behavioral health field has often sat sort of outside the rest of the healthcare ecosystem, and a lot of the uh, folks struggle with, well, where's the science for what it is that you're doing, right? It's certainly well known at this point that people who have comorbid conditions, let's say diabetes, hypertension, COPD, et cetera, that also have a co-occurring mental health issue, whether that be depression or bipolar disorder, schizophrenia, anxiety disorders, ADHD, whatever it might be, that it is more difficult to treat those comorbid conditions. And without effective behavioral health treatment, you're going to have much higher costs on the physical health side to treat that individual. So if we can get more standardized practices about, measurement, responding in the moment to individuals, and keeping them engaged and meaningfully knowing what their progress is, and by sort of extension of that, knowing what their goals or what their targets are, that is going to keep them engaged and probably have a significant impact on their comorbid conditions as well, right? So I think that if we can have meaningful measurement informed care strategies that are implemented broadly, that's going to begin to set the floor of this is what the expectation is, and this is how we're going to be knowing that we have success. That is going to then help us to be able to negotiate around payment and rates, and perhaps getting into more value-based and population-based contracts, as opposed to getting into this fee-for-service and arguing about whether one particular service was necessary or not. We're really going to be getting on what were the results rather than the inputs to those results, which is predominantly how we get paid now. And I think that at the end of the day, we're only going to be able to be effective if we can get creatively away from the fee-for-service sort of models for care purchasing.